Okay, folks, chapter one of the ACE sixth edition personal trainer certification workbook. And chapter one, of course, is basically an introduction. It's part of the first section, chapters one and two. And so as you're going through chapter one, as with all of the chapters, make sure that you've got writing implement and you've got some paper to take some notes. Remember, the goal is to read and rewrite the material. Again, the read, write, recite component adds that little extra of saying it out loud, so you get that auditory connection with your study materials. Be efficient, be effective. You don't want to keep going over and over again the same material because you never memorize it the first time, because that's really what the goal is. So in chapter one, again, got your materials to write with. Introductory, chapter one. One of the most important things about an introduction like this is that ACE is going to basically get you primed and ready for what the sort of the basis is for being a personal trainer, which is to help people to become more active. And so chapter one starts off with the role and scope of practice for personal trainers. Probably a good place to start, because in the end, we want to make sure that we fall effectively within the healthcare continuum, which is basically what personal trainers, according to ACE, are. So being part of the healthcare continuum requires that we know very clearly what we are basically legally and professionally able to do and what we should not do. So chapter one, as an introduction, is very important to remember when it comes to what it is we're actually going to be able to do as trainers and what we should not be doing, and what the healthcare continuum itself looks like. So not a bad idea to go ahead, look through the learning objectives, and right off the bat, table 1.1 is going to give you the health benefits associated with regular physical activity. Not recommending that you write this down to try and remember this, but the idea is that for sure, a lot of this is intuitive. So in chapter one, although again, the recommendation is to use note-taking materials, you can rewrite table 1.1. Just keep in mind that tables are given to you as a way to compile a lot of information that's in the written text, and it's compiled into a single format that allows you to get a lot of information in sort of a brief summary. So it's not a bad idea, even as we continue to move forward in the subsequent chapters, that always keep that in mind. If there's a table, it's not a bad idea to go ahead and think about right off the bat rewriting that table. So you would basically be using table 1.1, for instance, if you wanted to kind of rewrite each one of these bullet points. In this case, I'm not saying that it's necessary to rewrite this particular table, but it's a good idea. They put this out right in the beginning so you understand what the health benefits associated with regular physical activity are. There's probably more, and you probably already know the majority of these. But that's what ACE is trying to get you to appreciate, is that right from the get-go, we're interested in getting people more physically active. In the first figure, there are risk factors. I would definitely at this point go ahead and write down these risk factors. Again, if you're not familiar with them, find it hard to believe that you wouldn't be, but if you're not familiar with them, make sure you understand that tobacco use, poor nutrition, lack of physical activity, and excessive alcohol use. Those are kind of the big ones that we see from a all mortality perspective. These are risk factors. Doesn't mean that one specifically is causative to chronic diseases, but we know that each of those, if you smoke, everything else being equal, that's going to increase your risk of all of these chronic diseases. Okay, not all chronic diseases, but a fair number of them. Lack of physical activity. If you don't eat well, right? And we've got to define what good nutrition is, obviously. And so risk factors just help define those points, those behavioral components in a person's life that are going to make them more susceptible, everything else being equal, more susceptible to chronic diseases. And so right from the beginning in chapter 1, it's a really good idea to get an idea, to get this feeling for where physical activity and therefore the personal trainer fits in to basically the healthcare continuum. So again, as you move forward, one of the things that ACE has done, remember, there's a lot of material in the textbook. However, what they've done is they've given you these information boxes known as expand your knowledge. So it's a good idea to read through it because it gives some a little bit of real world information. And of course, depending on how quickly you're trying to move through the material, some of these boxes you can skip. I highly recommend you read through them. It's very interesting, very interesting material. So you've got an expand your knowledge on page 8, another expand your knowledge of the future of personal training, the expected growth, for instance, in personal training jobs is significant. A lot of business opportunities if that's what you're trying to move into, but also just jobs themselves within the personal training industry. Specifically now on page 10, what does the ACE personal trainer certification really entail? And what is it that you're expected to do? Because this is where scope of practice comes in. So you've got to define scope of practice. And it's basically the legal range of services. And we always talk about scope of practice in relation to other clinical specialists like physical therapists, doctors, nurses, medical assistants, things like that, because it's really the closest thing we can compare personal trainers to, other than like an athletic trainer, for instance, if you're working with sports teams. So the scope of practice basically defines those legal range of services that you are able to provide. And so as you read through that, you'll understand a little bit better why personal trainers fit within this set of actual guidelines, of things you can actually do with clients. And it's very specific. So here's a lot of written material on page 11. And so as you go to the next page, there it is, table 1-2. This is where you would definitely want to be looking at this table now, which has compiled all of that information about what the scope of practice is for personal trainers. So programming or diagnosing illness or diseases, that is outside a trainer's scope of practice. So table 1-2 gives you the do's and don'ts, right? That's what a medical practitioner prescribing diets or nutritional supplements. Keep in mind that ACE will not talk to or speak to the personal trainer engaging in nutritional guidance and diets and writing. Okay, that's outside, technically, according to ACE, that's outside the scope of practice. So just keep that in mind as you continue through the rest of the textbook. Now, as you move through knowledge, skills, and abilities of the certified trainer, there is another expand your knowledge box in here that you can read through. And as you're continuing through, again, chapter 1, I'm just kind of getting you to move through, read through it. You are not trying to memorize a whole lot of chapter 1. It's just it's an important, valuable resource, particularly even after you get certified. Remember, there's a testing component of this, and for the most part, that's why you're going through the book. But there's a lot of good material that once you're a certified trainer, it's going to be very valuable. And that's why they've got it right at the very beginning of the textbook. And so as you move through, continue page 16, we move into what are known as professional responsibilities and ethics. So normally, scope of practice, code of ethics, professional responsibilities, they normally are grouped in the same, either in the same chapter or in the same area of a chapter, and that's what we have here. So now, again, expand your knowledge box. There is the ACE code of ethics. So by the way, that's in the appendix. You'll be able to read through that. So breeze through kind of this area of chapter 1. It's getting you prepped. Keep that in mind. ACE gives you information on the certification period and the renewal, client privacy. By the way, you may see actually some of this material on the exam. Now, there's not a whole lot of material that they will draw from chapter 1 or even chapter 2, but it's a good idea to make sure you're familiar with it, right? Safety, emergency procedures, referrals. This is an important part after you're certified. Once you're actually training folks, you should be able to understand the referral process. Normally, it's not a bad idea to write this down. Normally, the first thing you're going to do is simply refer a client to their primary care physician, right? PCP for short, their primary care physician. That's the way I've always done it. I'm not going to refer somebody to a cardiologist. That's what a primary care doctor is for. They're kind of like the quarterback, right? In the healthcare continuum. They're like the quarterback. They're the ones that are determining where the pass is going to go. They're determining where that particular patient should be sent to. And if you've been in the healthcare field and any or interacted with physicians, you know that's the case. They're the ones that will refer you to a specialist. You're basically like a pre-quarterback. You're getting them to the quarterback, so to speak, if that helps. Supplements, other nutrition related concerns. Again, they're going to hit you right from the very beginning here in chapter 1 on page 19. They give a fair amount of information. ACE wants you to direct people to government websites and take all of the responsibility off of you as the trainer. So there's no liability issues. And that's really what this is about. When it comes to nutrition and supplements, I would say it anyway, don't be recommending that people take fat burners and pre-workout supplements, things like that. As a professional, you got to be very careful. That's outside of your scope of practice. I'm trying to make sure that you understand that right from the beginning. As an ACE certified trainer, those things are really outside what you should be doing with folks. If a client wants to use supplements, that's on them. Your job as a trainer is to explain to them. That's why you want to know about supplements, but not recommend them. There's only a couple that you would recommend anyway, and ACE will speak to that in later chapters. And so they give you, look, they're giving you in table 1.3 on page 20. That's where you're going to slow down a little bit. And again, if I'm studying through the materials, I'm slowing down. I'm always geared towards tables and figures. Because I know that's what the authors of the textbook are doing, is they're basically telling you, look, we're compiling information and data, focus on this. I would be right here, table 1.3. This would be probably the first table that I would be looking to and taking notes on. And I would basically draw out the table, and I would try to rewrite it word for word. I would try to rewrite it. That's kind of your first memorization task, would be to know what the appropriate scope of practice is. Healthcare Continuum. Again, figure 1.3 basically shows you those specialty areas within what's known as allied healthcare. The gatekeeper, I call them the quarterback, but the term is gatekeeper, physician, or nurse practitioner. A nurse practitioner is what is known as a mid-level provider, and nurse practitioners can basically do anything. Now, they have a master's degree. Nurse practitioners have a master's degree, whereas a registered nurse or an RN normally have bachelor's. So the nurse practitioner gets a master's degree. That basically allows them to do pretty much anything that a MD or a DO can do in healthcare. The only thing that nurse practitioners are not allowed to do within their scope of practice is to prescribe narcotics, but they can prescribe pretty much any other medication. Normally they work with a medical doctor or a DO, doctor of osteopath. So basically they're going to work with them and basically follow whatever guidelines. But some nurse practitioners that I've known and that I've worked with are, as far as I knew, they were as proficient and knowledgeable and just incredible clinicians, as much as any primary care doc that I've ever met. And so that's kind of the idea, is that the gatekeeper is and that's who's going to make the determination. So as trainers, our goal is to get our clients, if there is an issue, is to get them to their primary care primary care doc or their nurse practitioner. Now, again, here we are on page 22. I'm going to make a recommendation. It's not a bad idea to read through the expand your knowledge a box here, but it's pretty extensive, because not that you're going to see questions on it on an exam, but once again, you're navigating, right, the textbook for examination passing purposes, because everything on the exam is going to be in here. But you're also trying to learn as much as you can about where you're going to be fitting in to the healthcare continuum, perhaps. And so, again, not a bad idea to read through the materials on page 22, 23, and then of course 24. And again, I mean, there's a lot of information here on that one knowledge block. And then exercise professionals in the allied healthcare. ACE is trying to, in chapter 1, to get you primed and ready to see where the opportunities are. It's not just about training people in a health club anymore. Okay, you can, as an exercise professional, especially as an ACE certified trainer, start to look at more clinical areas in which to conduct your business. That's why ACE has really moved forward and tried to connect itself as much as it can with the clinical world. And so page 26, ding, ding, this is kind of where it is. Recognition from the health and fitness industry. If there's anything that is important in chapter 1, it's understanding that an NCCA accreditation is really important when it comes to recognition within the health and fitness industry. That's why we have a number of NCCA accredited organizations, certifying bodies, with ACE, at the top. So as you move through and continue, again, read through it, be familiar with it. And then there's recognition from the education community, and therefore career development, depending on what you're going to use your certification for. Some of this can be really, really important, or perhaps not. So degrees and new areas on page 29, new areas of expertise. Again, this is a kind of an interesting area that you can start moving into. Now, I ran a hospital-based wellness center for a number of years. And so, there are these different areas, and I would be looking, if I would, as the director of the wellness center, I would have always been looking for trainers that were not just certified, but I'd want to know what certification they had, for instance, and know what their experience was. So there are these, opportunities that ACE is kind of letting you in on. And I think it's actually really, really important that they do this. As you get to the end of chapter 1, just keep in mind, you can basically make it through chapter 1 fairly quick. Read through the summary. One of the things to keep in mind is that what ACE has done, particularly in this newer edition, is they've tried to take a lot of the material and historical data now that has been collected over decades and decades within the personal fitness industry, and they've honed it down, and they're trying to get you as the soon-to-be trainer well aware of all the opportunities that are out there. So again, chapter 1 is an introduction. If you don't have any time really to take the exam, you're probably going to breeze through chapter 1. But if you've got time, I highly recommend you go through it, get yourself familiar with it, because believe it or not, it's getting through the rest of the textbook that all of a sudden you're going to go back to chapter 1 and look and go, okay, maybe there are some opportunities that I did not realize that you can see in here. So again, that's the end of chapter 1. As you move through this first section, chapter 1 and chapter 2, just keep in mind that you're going to be kind of exposed to a lot of information. Just make sure that that you're aware of this. Chapter 1 is an introduction, but it's getting you prepped. I'm giving you some context for what you're going to see in the subsequent chapters. So again, look forward now to seeing you in chapter 2.